This tablet is a multivitamin product that is used to prevent or treat vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and help to maintain good health. It includes Bcomplex #4, Vit D3-C-Fa, and Zinc Ox, which are important for various bodily functions. The recommended daily dosage is typically 1 tablet a day. It is best to take this tablet with a meal to help with absorption. Taking it at the same time each day can help you remember to take it regularly. When taking the Bcomplex #4 Vit D3-C-Fa-Zinc Ox tablet, it is typically taken by mouth once a day or as instructed by your doctor. Be sure to follow the directions on the product package and do not exceed the recommended dosage. It is important to take this medication regularly to receive the maximum benefit from it. To help with consistency, try to take it at the same time each day. If you have any questions about the medication, it's best to consult with your doctor or pharmacist. If you experience constipation, diarrhea, or an upset stomach after taking Bcomplex #4 Vit D3-C-Fa-Zinc Ox tablet, don't worry. These effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, make sure to let your doctor or pharmacist know right away. It's important to remember that if your doctor has prescribed this medication, they have determined that the benefits outweigh the potential side effects. Most people who use this medication don't experience serious side effects. While it is rare, a very serious allergic reaction to this medication can occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. And remember, always consult your doctor before starting or stopping any medication. As for the optimal timing and dosage, it's best to take this medication as directed by your doctor. They will be able to provide specific instructions tailored to your individual needs. It's important to keep this multivitamin product out of reach of children, especially if it contains iron. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If overdose does occur, it's important to seek medical help right away or call a poison control center. Before taking Bcomplex #4 Vit D3-C-Fa-Zinc Ox tablet, it's important to let your doctor or pharmacist know if you have any allergies to its ingredients or if you have a history of alcohol use, liver problems, or stomach/intestinal issues. If your brand of multivitamin also contains folic acid, be sure to inform your healthcare provider if you have a vitamin B12 deficiency before taking it. It's also important to inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before having surgery. If you are pregnant or breastfeeding, it's important to consult with your doctor before using this medication. Remember to always talk to your healthcare provider for more details. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If your multivitamin contains iron, avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or some antibiotics. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. This medication may interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this drug. If you or someone you know has taken too much Bcomplex #4 Vit D3-C-Fa-Zinc Ox tablet and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. You can call 911 or your local poison control center for assistance. Overdose symptoms may include stomach pain, nausea, vomiting, and diarrhea. It's crucial to seek help as soon as possible in case of an overdose. Make sure to attend all your medical and lab appointments as scheduled. Certain brands of this tablet may also include additional ingredients like docusate. If you have any questions about the specific ingredients in the brand you are taking, be sure to ask your doctor or pharmacist. It's important to note that this tablet is not a replacement for a healthy diet. It's always best to obtain your vitamins and nutrients from a balanced and nutritious diet. Be sure to follow any dietary recommendations given to you by your doctor. As for the daily dosage, it's recommended to take 1 tablet daily, or as directed by your doctor. It's best to take it with a meal to help with absorption. When it comes to the best time to take this tablet, it's generally recommended to take it at the same time every day to help establish a routine. This can be in the morning with breakfast or in the evening with dinner. Just be sure to take it consistently at the same time each day. If you forget to take a dose of this product on your prescribed schedule, take it as soon as you remember. If it is almost time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. It's important to store the Bcomplex #4 Vit D3-C-Fa-Zinc Ox tablet at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and out of reach of children and pets. When it comes to disposing of this medication, it's crucial to not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.